viewers, you're welcome to another edition of Sight Ed, and today we will be talking about a very common condition. I want to believe many of us will have seen children or some adults who continually itch their eyes non-stop, and such persons may also have associated catarrh or itchy ears or itchy throat. Today we will be talking about allergic conjunctivitis. As I said, this is a very common ocular condition, and we also have an expert who will be talking to us on what is allergic conjunctivitis, how does it present, and how do we treat or control allergic conjunctivitis. Once again, I'm your regular host on this program, Adepoju, and we do hope that today we will have an interesting and an enlightening session on Sight Ed.
I am Patricia Wade. I'm a consultant ophthalmologist with the Jos University Teaching Hospital and an associate professor with the Department of Ophthalmology, University of Jos. We have a lot of, let me put it, dust, impurities in the air, and a lot of people react differently to all those things. Some people can tolerate it, some people will have it and not even react to it, while others react to it. And even food, some people react to certain foods, and we call all these as allergy. Children play with dust, and you see a lot of them going about with red eyes on the street because after touching this sand, they put it in their eyes or they rub their eyes with their hands and tend to react to whatever they must have picked, from the dust. And you have a lot of people, like I said, reacting differently to even things in the house like their pets, their carpets, and even the flowers they have in their houses, they can react to it. Some even react to some drugs that they never knew they were reacting to it, and maybe taking it for the first time, they can react to it and give them an irritative condition we call allergy in the eyes. Yeah, the thing about allergic conjunctivitis is that it takes a long time before the patient even start reacting to these, what we call allergens, that's these impurities in the air, that cause the reaction. So at the end of the day, it comes with certain things. There are some people that may present with just irritation in the eye, some will present with redness, some will tell you that they feel as if they have some foreign body sensation in the eyes, and some may have discharge. They'll wake up in the morning and say their eyes are sticking together. It's not as if it's, the kind of discharge you see in Apollo. But in fact, some people with Apollo will also tell you that they have this irritating, itching, and foreign body sensation. But in allergic conjunctivitis, like I said, it takes a long time for the patient to start reacting. So it's a very chronic condition. What we call chronic, that is, it takes a long time for the patient or it stays a long time with the patient. When they have what we call rhinitis, some asthmatic patients have allergic conjunctivitis. We have people that have catarrh. They can even have associated allergic conjunctivitis. We have people that react differently to so many things, systemic or some reaction in their bodies. We also end up with allergic conjunctivitis. Some of them, not many anyway, some may present with itchy throat. When we have patients with allergic conjunctivitis and complain about the problem with their ears, their nose, and the throat, we bring in the ENT surgeons to also assist in managing these patients. Apart from the itching and the redness, we have they have foreign body sensation. They feel like as if they have sand in the eyes, you know. Some of them will say, it's like I have worms walking in my eyes. You know, they have all kinds of bizarre complaints. But if you look into the eyes, you see what we call, they look like rashes on the conjunctiva, on the inside of the conjunctiva. That's the upper part of the conjunctiva. You invert it like the way we play. You know, children play inverting their upper eyelids, and you see these rashes, you know. They are called papillae. So they give them this foreign body sensation. Some may be even very big. And then we have tearing. Some people will continue to tear, and some would not even want to see light, you know, because of this irritation in their eyes. So the irritation is when you see children scratching and scratching their eyes, and this is one of the first things the parents see and say, oh, my child keeps on scratching the eyes, and then before they now notice that there's a lot of tearing, then the discoloration of the eye becomes brownish or reddish, as they'll come and tell you. So these are the things we notice in allergic conjunctivitis, both in adults and mainly in children. I have seen where it has led to blindness. I have seen where allergic conjunctivitis, what happened was, as a result of the continuous rubbing, the conjunctiva, that is the membrane in the eye, grows, you know, becomes very thickened, grew over the transparent parts of the eye, which is the cornea, and covered it, and the patient came with very low vision. But what we did was to raise this conjunctiva and then excise it, and the patient's vision, you know, was restored. So it can lead to blindness if not properly taken care of. Most times we don't want to tell people this is what you should go and take, because some people, you know, when they enjoy taking certain drugs, they will not want to come back to the hospital. But there are many drugs in the market, so we give them antihistamines, which are present in the market, which are present in the chemist. So we buy these drugs, we recommend these drugs for them, they take them, and in some cases they may be so serious that we have to add steroids to, you know, to take care of the acute stage of the condition. But we have to leave it, you know, after the acute stage of the disease has been taken care of, and continue with antihistamine, which does not give any problem, because continuous use of these steroids can lead to glaucoma and cataract, which we discourage patients from using. And most patients enjoy using it that they even go and buy it secretly, even without the doctor prescribing, or the doctor has asked them to stop. And they find out that if I continue with this drug, I enjoy using it, not knowing the effects on them, you know, after a prolonged use of this drug. A lot of patients have noticed, some of them have noticed what they are allergic to. Let me give you an example of my son. He noticed that anytime he took anything containing egg, be it cake, be it just the normal egg, boiled or fried, he starts having this terrible allergy, you know, reaction in the eyes, not even in any part of his body, not even in the ear, not in the nose, just in the eyes. So, yeah, and it took him some years to notice what he was allergic to. So if you know what you're allergic to, try as much as possible to avoid. And then washing of the face is very important regularly. If you notice that the children play with sand and put back these same hands into the eye and rub them and continue complaining, you have to have a way of stopping them. And once you have children with allergic conjunctivitis, bring them to the hospital. We usually advise you bring them. So, and the advice again is that, like I said, this thing took a long time to manifest, that is, to show up itself that this person is having this problem. So it takes a long time to treat. But we have parents that are very impatient. They will come after a week or two. They will say, I've used 1 or 2 bottles, and the child is not even responding. And we usually advise, please, it will take a long time. Just like it took a long time for the child to notice that he has this condition, it will take a long time for this child to also be treated. And some of them, as they grow older, the disease also, you know, it gets cured. But at that stage that we are treating, we are only reducing the effect or the symptoms, or we are making the child comfortable with treatment and not really giving him a permanent cure. So there's, in treating allergic conjunctivitis, especially in children, there's patience on the side of the doctor and patience on the side of the parents and the child we are treating. One last word for those with allergic conjunctivitis is for you to come to the hospital. When you have symptoms, do not go to the chemist and buy things all off counter. And in some cases, you have people who have had allergic conjunctivitis or some form of these eye conditions, and they'll tell you go and use certain things like herbs, like urine, like onions, that it will even give you some relief. Please do not do that. Come to the hospital. No supplements can cure allergic conjunctivitis. The drugs are in the hospital, and you need to see your doctor who will prescribe all your drugs for you, and I believe you'll be much relieved than using those things that will further destroy your eyes. Thank you.
Well, thank you very much, Dr. Patricia Wade, for all that you have taught all of us on allergic conjunctivitis. So remember, everyone that have chronic itching on and off, you need to get treated. And please don't use some drugs that could be dangerous to your eyes, like steroid and some other traditional eye medications that could complicate these ocular issues that we've talked about.